Hello, friends, and welcome to another episode of the This Is Gonna Hurt podcast with J. Gordon Duncan. And if you're wondering why the J, the answer is, I'm not a bagpipe player. And if that joke doesn't make any sense, I encourage you to check out episode 0, where I explain that joke, as well as the purpose of the This Is Gonna Hurt podcast, where we talk about faith, family, fitness, finances, and sometimes fun. Hey friends, welcome back to the This Is Gonna Hurt podcast. I appreciate all of you. I never start an episode without saying thank you. So many of you have been listening to the episodes this summer. Last week with Ron Keel was just a blast. I just tell folks, basically, I bring on whoever I like and talk to them, and then I hope you enjoy it. But all of you did. A lot of people liked and shared the episode. So special thanks to Ron. Thank you for supporting that episode. And today, I'm excited. I have my friend Corie Bacher here. Corie, thanks so much for being here.
Oh, thank you for having me. I really appreciate this opportunity. It's always great to chat with you.
Yeah, is this your first podcast?
This is my very first podcast,
so
I'm a little nervous.
Oh, don't be nervous. This is nothing to worry about at all. Well, this is awesome. I'm glad you're here. Well, if you would, just introduce yourself a little bit. Let's know who you are.
Well, I'm Corie Bacher. I am a mother of 6. I work for the Lloyd Moss Free Clinic doing grant and development work for them. Love it. I was a middle school science teacher for many, many years and did a career shift and pivot and finally found my professional home. So
yeah.
The mission at the clinic is just, amazing.
Well, I want to hear more about the clinic, but I forgot. Now, you were a school teacher for how long?
Oh, gosh. Am I going to date myself? Many years.
Many years.
Many
Double
years.
digits, like 10
Yes,
plus
yeah,
years?
mhm.
Okay. I think I've told you. I was a high school English teacher for 4 years. And I almost hate saying 4 years because I speak to teachers and they're like, I've been doing it for 15, 20, 25, 30. I almost feel like my 4 don't count. But before we get into your nonprofit work and that kind of thing, how was being a teacher preparing you to do like nonprofit work that you do now?
I think to be a teacher, you have to show up and be compassionate every day, and you have to be able to roll with the punches and recognize that no 2 days are going to look exactly alike, and you have to be able to pivot on your feet and realize that there is something much larger than yourself.
Wow, that's amazing. Like, you should do a commercial for being a teacher. That's especially right now with our school system. They're dying for teachers right now. So in my few years as a teacher, I know that you're right. No day is the same. Mm-hmm. No day goes as planned.
No.
Literally, there's nothing that you could plan that would happen. And some of my best stories ever came from teaching. But so now I know that you and I did some work together in Chamber of Commerce, but now you're at the Lloyd Moss Clinic. I want to make sure I say that correctly. And it's a free clinic.
It is a free clinic, and it's for anybody in Planning District 16. So it's Fredericksburg, King George, Caroline, Spotsylvania, Stafford County, and we provide free medical and dental care to low-income, uninsured adults.
That sounds like it's not possible. Like you just offer free medical care.
Free medical and dental care and pharmacy services. So, and we do accept Medicaid as well. So it is an amazing asset in our community, and it's definitely underutilized. Mm-hmm. And I appreciate this opportunity to come on and share a little bit about what we do and who we serve.
Well, Capitalize just got partnered with you guys just in the last couple of weeks. Yes. And then I got to hear a little bit of the history. And I was amazed that, it's not a short history.
No, we're almost coming up. We've been in business 29 years, so our 30th anniversary will be November 2023.
Wow.
So Dr. Moss, who was a physician in town for many, many years, started the free clinic. Originally operated out of one room out of Mary Washington, old section of the hospital, which is now, as I understand it, the parking lot.
Okay.
And then about 15 years ago, received substantial outpouring from the community and built the facility that we're in now, which is on the Mary Washington campus, in the Carl D. Silver Health Center building. Been there for about 15 years. Beautiful exam rooms, 6 dental operatories.
Wow.
Amazing. We have a pharmacy. We also our pharmacy also dispenses medications to 12 other free clinics in the state of Virginia. It's amazing.
Do you think the challenge, I can imagine just from my perspective, I imagine you've got challenges for funding, challenges for staffing, and then none of that has anything to do with actual patient care.
Correct.
So I managed an eye clinic for 4 years. Seems like I only do things for 4 years, and it had 14,000 patients, and it was a zoo, and ours was run really, really well. So, of those three, funding, staffing, and patient care, which one do you think's the biggest challenge right now?
Probably by far, it's probably funding because we are a free clinic. We rely completely on donations and grants to fund us. And then our staffing, we do have full-time staff. If one full-time nurse practitioner, just have a new part-time nurse practitioner coming on staff, some full-time RNs as well. But our core of our services are volunteer medical providers within our community who donate their time. So we have clinics. We're open 9 to 5 Monday through Friday. We have an evening clinic alternating Tuesdays and Thursdays. We do a women's health clinic the first and third Wednesday of the month. And kind of one of the most amazing things I think about the free clinic model is we think about, we're completely, all of our completely funded through donations and grants that we were able to leverage. So for about every dollar that we take in, we're able to transfer that into about $15 in direct patient care.
That's insane. That's an incredible. I know that a lot of nonprofits work off trying to work off like 98%.
Exactly.
And you're multiplying.
We are multiplying, and that really
How's that possible?
And thanks, it's because we have these compassionate providers in our community who are willing to donate their time to provide care. So we provide outpatient primary care, chronic care, acute care. We can also refer out to volunteer specialists. As well. So, and then you think, our patients who have some chronic conditions, all of our medications are $3.
Wow. So I understand in light of HIPAA, you can't share like, hey, this person. So you've got to be very careful. Can you, in general, share a couple of success stories that you have the freedom? Do you have the ability to speak in generalities?
I think in some generalities. So, for example, for our women's health clinic, we had a patient who came through. It was one of her first, women wellness exams, and actually we were able to diagnose early stage breast cancer. So we were able to save her life essentially. So without us, she would have prolonged care. It would have been,
wow.
The health outcome would have been.
Do you find the patients? What are your patients like? Do they have a sense of like overwhelming, like this is amazing? The gratitude, or do you? What's your client base like when they're coming? Are they coming because they're like, I didn't know you were here, or what's it like working with your patients?
So that's a really good question. So I think once they realize everything that we provide, there is that huge sense of relief, and we become their primary care provider. So that preventative care is key, and especially I think as we're looking at just what life looks like after COVID and how it is, the ramifications worldwide. Being able to be a source of preventative care for patients who neglected that or not had a place to turn before. Really, it is to see the smiles, and know that you have taken a weight off their shoulders. Many of our patients who come to us, they're choosing, do I buy my medication? Do I pay my rent? Do I buy food for my family? So they have, lots of other challenges as well. And so to be able to just be a safe haven for them and to be able to provide care and, with dignity and respect, which is, the heart of our mission.
The doctors I know will often tell me preventative care is the biggest challenge. And then we went through COVID where preventative care disappeared.
Exactly.
Like you didn't go unless it was acute.
Right.
And now trying to build back the sense of it's okay to go see your doctor for preventative care. And then you already got a patient base who have never had that opportunity. Right. So is that what you communicate? Like when you're going and you're trying to raise funds, this is your job. Your job is to, it's all on you, Corie, to raise it. But like, what's your central message when you try to go speak to folks about supporting what you guys are doing?
I think the central message is just to realize that, being able to help share the message of who we are. So many of our patients, not all of them are unemployed. Many of them are employed. So many of the businesses within our community have employees on their staff who qualify for our services. So being able to convey that message that, being able to provide all of the services that we do provide, really important and has great ramifications, for our entire community. So that, what is that old saying? An ounce of prevention is worth a pound of
cure.
or
Yeah,
whatever.
yeah.
My
It's close
grandmother
enough.
used to say. And when I was a kid, I was like, what does that mean? But now I live that every single day. So being able to provide those services for patients and get on top of things. I mean, many of our patients have, diabetes, and being able to provide those medications that they can afford and to be able to be followed by their physician and have that, team approach has just been amazing. So it depends on the audience and who I'm pitching it to and what, heartstring I need to appeal to. But really, a healthy community, a healthy individual breeds a healthy community.
Right. The rising tide lifts all shifts and that kind of thing. Well, we'll take a shift here for a minute. I know personal fitness, personal health is a passion of yours.
Yes,
I know it is. So, before getting to 2020, what have been your passions? Like, what about personal health, personal fitness? What are the things you've been passionate about?
Oh, movement. I am definitely, a big believer. Body in motion stays in motion. So I have always, been one very active, running, horseback riding, mountain biking, all been very, very important to my children. All 6 of them will tell you that if mama doesn't get her exercise, and nobody's happy for the day.
Right.
Being able to move has been an essential part of who I am, and
So in 2020, you and I think you and I were still part of the chamber at that point in time, and so we're all communicating via Zoom and that kind of thing. And then I hear from you, I might lose my foot.
Yes.
I think that's the way you said it to me.
So. I think
and I'm like,
probably.
what are you talking about? Because I know we had talked so much about running and mountain biking and that kind of thing. So if you don't mind, I think it's inspiring. Walk us through a little bit of that story, because I was stunned, like, when you told me. And I'm sure most people, we're interacting with someone who's active and moving. Like, what happened?
Right.
What happened?
Yeah. So it was quite simple. So I had, like many people had this, annoying bunion on my foot that I finally had gotten to the point where I was like, okay, if I go for a run, I can't really walk after because the bunion just hurt so much. Like, it's time to, to take care of it. And so surgery was really the only option. So of course this was, middle of 2020. So they're finally able to start doing some of those, medical procedures that weren't, emergent, that had been shut down for the first half of the pandemic. So had my surgery, first 10 days, everything is fine, foot looks normal.
Good, yeah.
And then about day 11, 12, suddenly it starts to look a little not so appealing, and the incision starts opening back up, and that started this long, long process, which led to the 3 subsequent surgeries. So if you want me to go into more detail.
So you had 4 surgeries total.
4 surgeries total.
And so essentially what went wrong with the first surgery?
So a good question. So one of the theories, apparently I am some sort of medical anomaly, that perhaps I was allergic maybe to the internal sutures. The first surgeon who did not do the final 3 surgeries, I think sort of, maybe things got a little bit out of his comfort zone, maybe his control, and wasn't really confident enough to say, I think maybe we need to send you to somebody else. I went through a series from about July to September. This lovely little incision just kept getting bigger and bigger and bigger, and I would go back every week and they would re-stitch me up, and it would just start opening up. And it was about, and of course I couldn't bear weight. I was originally promised that I would be running within 2 weeks after my first surgery.
Oh my goodness.
So I was like, I can handle 2 weeks of
I
downtime.
can have 2 weeks.
Like, it's a little be hard, but I can figure it out. Obviously it did not turn out that way. September, you could suddenly now see the tendons in my foot and hardware, and it was.
So when was the first time someone said to you, there's a chance you could lose this foot?
That was in September when I went and saw the original surgeon, and he wasn't going to stitch me up, told me to come back the next day.
Okay.
And I was like, okay, time to pivot. Called fabulous physician in town, said, come on in this afternoon, got there, and his face kind of went a little white and said, I can't sugarcoat this for you, but we have to admit you have to do another surgery. It's going to be a really long process. We are just going to focus on trying to save your foot.
So, can you tell me what you thought, how you felt?
I was just kind of stunned. Completely stunned. There had been some moments earlier on with the first guy where I wish I had listened to that inner voice that we all have that said maybe something isn't quite right. I, of course, like many people, completely trusted my physician. I didn't go to medical school, so and I wish that I had advocated, and that I think is something that's kind of carried over into my work today now as well. And so when I went in for my second surgery, and I woke up with an external fixator on my foot, which was just...
So what is that? What's an
that
big round thing? Like, what is it, a fixator?
Yeah, it's a fixator. So in my case, because it was my foot, it's essentially 4 external screws screwed from the outside into the bone, and then a metal rod on the outside.
Okay.
So as you can imagine with that, your wardrobe choices are completely limited.
Just wearing sweats, I guess. I don't even know.
Yeah.
So,
and I was confined to bed at that point. I mean,
Wow.
I was
Right.
really, had been on crutches, obviously, since July, but even at that point, it then became, you can only get up, for essential bodily functions.
Right,
You
right.
can't, and certainly showering was,
Right. I don't even. Yeah.
it was horrible. And I ended up having to go home on IV antibiotics.
Okay.
Which apparently I realized I was allergic to one of them that they gave me, so put me into, almost liver failure. There was a whole lot of, just stuff. But then I had to, about 10 days after that second surgery, they had to go back in and apply a few more staples.
Okay.
And it was with that surgery that then things really started to fall apart, that my skin just kind of, he said, sort of just, for lack of a better word, was very friable, just completely frayed. There was nothing to it, attached to sew it back up. So woke up with a lovely little skin graft from a cadaver on my foot, in addition to the external fixator, which I was supposed to only keep for 4 weeks, turned into almost 2 months, because just nothing wanted to heal.
So I want to hear about the success of where you're at, but just one more question, if you don't mind, because you gave me freedom.
Yeah.
So, what was the toughest point? Can you remember, just this couple of days, a week, a season, where you're like, this is where I'm at my lowest?
Well, probably it was after my third surgery, when they wanted to go in and put a wound vac on, because just it wasn't healing. And that's essentially where they pack a wound and then attach it to a vacuum. And it was this box that I had to wear around and carry with me 24/7. And that...
How big is this box?
It's not that big, maybe, I don't know, 6 by 6. Not super huge. But when you're on crutches and you can't move, for me, that was just the last straw. And it was a Thursday that the nurse, home health, I had had home health this whole time. Delightful nurse came, put the wound vac on, showed me how to empty it and do all of that. By Saturday morning, I was ready to jump off a bridge. It was just too much.
Were you angry?
I was very angry.
Okay.
I hadn't really been angry. I don't think truly angry. And I don't know if so much anger or just completely frustrated. I mean, I went from being very, very, very active.
Right.
To confined to a bed since July. So I called my, doctor and said, I called, actually, I think it was home health, and I said, you have to come take this off of me today, because I'm going to literally jump off a bridge. I mentally cannot do this anymore. And they were like, oh, we need the doctor's orders. So I called the doctor and said, unless you tell me you're going to have to amputate my foot, please take this wound back off. So they're like, let's try.
Okay.
I think your mental health is more important at this point.
Okay, good. So they took the
they
box
took
off.
It off. And yes. And I think it delayed the healing, but it was such a relief. That was the one thing. So shout out to all of those people who've had to deal with a wound vac, and they were able to.
Never even heard of a wound vac box. So that's.
Yeah, no, it was not pleasant. And I think maybe if they had put it on, maybe week 3 of my whole ordeal. But.
Gotcha.
But November was not. Yeah.
So when was there a turn? When did you finally feel like, okay, I'm getting better?
It was probably January, when I could finally start to walk in a walking boot. Kind of felt like I had my life back. I mean, I will say, I did some things that I shouldn't do because I just couldn't handle immobility. So I think after my first surgery, before I'd seen the second surgeon, I did get out on my mountain bike.
Okay.
I didn't go on the trails, obviously, because my foot was disgusting, and
Right.
just biked around. But my
Okay.
family was horrified. My
course they were.
children were,
So angry with you.
Yeah, but I'm like, I cannot not move anymore. Like, Mama has to get out
Right.
and move.
So when did the doctor finally say, okay, you can attempt a small run?
That was probably in April.
Okay,
So
so
I started
July to April.
Yes.
Okay, I don't know what that, 9-10 months, something like that. Yeah.
And it was, you can run maybe 5 minutes.
Okay.
And then walk 5 minutes.
Okay. How painful was it?
And call it a day. It was not as, well, it was painful, but I think it was more just the first few steps, nervous.
Mm-hmm.
And probably the hardest part was because I had no flexibility in my ankle.
Okay.
That it was very awkward, that motion.
Mm-hmm.
And so, if the road got the least bit uneven, I was completely unsteady. I mean, I couldn't stand on my foot at all.
Okay. You were running, but you weren't very good.
I was not very good, and
Right.
if I had, I literally couldn't balance on my right foot.
Gotcha.
I would have failed the test.
So they're assuming you're just completely drunk at that point in
Yeah,
time. And
exactly. Yes.
So by no means a 1-to-1. The only thing I can relate to that is, I remember you've heard my seizure story, and I was just zonked out on 2 meds. They were trying to find the right one, and we lived in an apartment, and I would do this little loop around the apartment, and it was just a 1-mile loop. And I remember about a half mile in stopping. My brain wasn't working, my body wasn't working, and just literally crying. Just crying, walking, because I'm only 18 months removed from a really good marathon.
Right.
And then I was like, I can't run. And when people ask me, why can't you run? I'm like, I can't explain to you why I can't run. It's just that I can't. I don't even know what to do with it. And I literally just cried. I had my anger moments, but that one was just tears. I'm like, I don't know if this is going to be taken away from me. Did you have a moment where you thought, I'm never getting my movement back?
I did definitely had that thought, and it was, I went from when I had the first surgery, like, I'm going to be running in 2 weeks.
Mm-hmm.
And as things progressed, my mindset really did shift to, I just want to walk. I want to be able to walk to my kitchen and get a cup of coffee, and not have to try to hobble on crutches and those sorts of things. So I really did experience that shift and was very, very thankful and grateful. And then as I started to get a little more mobile, still not where I wanted to be, then I did have some more of those frustrating moments. I had a lot of them when I was on my horse riding, when I just couldn't do what I wanted to do, and I would just start sobbing.
Okay.
And my daughters were so great about encouraging me and saying, Mom, look what you've been through,
Fantastic. So
they were very
roles kind of turned a little bit.
They were very, yes. So.
How much does it affect horseback riding? I don't know anything about horseback riding.
Oh,
zero.
Yeah, so
I just would assume it's all quads and knees. I don't even know.
No, you're basically just balanced, and then really being able to push your heel down and your toes up to really wrap your legs around and stay balanced is really, really, that's really what keeps you on a horse. So just not having that, and then not being able to move my ankle, and just there's a lot that you need. You have to. Horseback riding takes a lot more out of you than people.
Oh, I imagine, but again, I don't think I've ridden a horse since I was 14, so I don't have any concept of that whatsoever. So. I asked you on the way up here, and you're like, you're running 4 days a week. Is that right? And then are you cycling still? Or?
I am cycling. I haven't been biking as much. I'm doing a whole lot of horseback riding. I'm getting ready for a horse show next week, so excited about that.
Are you competing?
I am competing.
That's incredible. Okay.
So I am excited for that. So trying to keep the right muscles going. So but yeah, so running at least 4 days a week. Would like to run more, but I've discovered that
back-to-backs don't work for you. Is that right?
Well, I can do a few, but then it lets me know I've done too much. And so.
What gives you more joy, horses, biking, or running?
Oh, that is a really tough question. That's like asking which is your favorite
children.
child.
I know, isn't that funny?
They all give me something sort of different that I need for me to stay kind of balanced. So. Yeah, that's a real tough one.
So now I'm going to try to bring this back to where we started. You've been through a massive medical journey. I mean, multiple doctors, home health care, came to drugs that you were allergic to. It's massive what you've been through in 2 years. Now you're involved with a clinic that wants to provide free care, amazingly affordable pharmacy. How does what you've been through inform what you're trying to do right now?
I think really it's about advocacy. Advocating not only for yourself, but advocating for the people in your community or your family. I think that's really key. And I think quite often we don't speak up. We don't seek help where it's available to us. We don't really look for those resources. And we don't take the time to kind of do our research. So I think there's been a huge myth, a little bit of time that I've been with the clinic now since, April, people who've long time lived in this community, really not aware of what we do, or they had some sort of misconceptions, like we only treat dental patients, or we only, and those sorts of things. So I think really, for me now, it's about advocating.
I think it makes such a difference when you know that something is available, or someone comes to you and lets you know of that opportunity. In my experience when we were up here, and I was preaching the first one, and I had a seizure in the middle of a sermon, and so I was having pauses. That's what I called them before, was pauses. And no one really noticed. They just thought I was kind of caught up in the moment, right? And we had an ER doctor in the crowd, and he came up to me afterwards and just said, "You just had a seizure."
Oh, wow.
I'm like, "What are you talking about?" And he goes, the layman's term was silent seizure, and he literally said, "Let me give you this doctor's name and number, and I want you to call him tomorrow." And that was the doctor who walked me through the entire process. You know how insurance and things changed. I'm not with him now. Wish I could be. But it required, because I was stubborn. I just thought, right. People, what would everybody tell you? Well, you're tired, you're under stress, and I'd just gone through my parents passing, so that, all of that. But it took someone to say, "Hey, you need to do something about this," and it did. It sounds to me like that is a role you're serving, but to a broader community. Hey, this is available to you. This is an opportunity for you. What's the clearest way for your target patients to find out about you? How do we let them know that this amazing resource is here in town?
Oh, well, certainly sharing. Again, if you're a business owner, sharing that information with your employees. mossfreeclinic.org is our website. There's a link for patient eligibility. People can put in their information to see if they meet the financial requirements in order to seek out our services. And we have some fabulous events coming up. The tennis tournament, of course.
It was a blast. That was so much fun. It really was.
Yeah, so mark your calendar for November 12th. We're doing our next fundraiser. It's going to be an oyster roast at Fred Nets.
Okay.
So really excited about that. But I think really just kind of sharing that information. So for everybody listening, take a moment, Google Moss Free Clinic. I would wager to bet that most of us have somebody in our circle, family, employee, friend, somebody who goes to church with us, who would qualify for our services.
Well, I'll put all that in the show notes and blast it out when we post the episode, of course. And so for you, make the pitch. You've got an opportunity now to speak to business owners, potential donors. Like if you wanted your target donors to know, what would you tell them right now?
I would say, all of us have, I shouldn't say all, but most of us have a capacity to give. We either have a capacity to give something from a financial contribution or of our time. So we also have, obviously wonderful volunteer providers. We're always looking for more volunteer providers, dentists, doctors, nurses, nurse practitioners, pharmacists, dental assistants, hygienists, all that sort of thing. Or again, if you've got an extra $1 or $2 or 10, think about being able to multiply that by a factor of 15, and being able to provide, so for every $10 that somebody donates to us, that's a patient visit. So thinking about, you have employees, need preventative care. If you want to cut down on employees missing, days due to illness, really kind of take a moment, go on our website, look at all that we offer. Be happy to come in and chat with business owners. So you're going to business
owners, talk to their employers. Awesome.
Yeah, absolutely. Kind of share who we are, what we do, what our need is. Obviously it's growing. I mentioned earlier that we do accept Medicaid. There's going to be I'm not exactly sure what date CMS keeps pushing the date back, where everybody who's on Medicaid is going to have to re-enroll. So many of our patients, or many of our, community members who have Medicaid, are going to have to re-enroll. More than most likely, some of them will no longer be eligible for Medicaid, but still will be eligible for the free clinic. Okay. So, as we all know, healthcare, that landscape is changing in addition to just life and.
So you have dental care, you have general practitioners. Do you have any psychiatric care or mental care?
We do mental health care. And again, if people go to our website, there's certain, disorders, levels that, maybe the Rappahannock Services Health Board would be more appropriate for some patients. But we do some mental health.
How helpful would it be for someone to come in? Do you guys do like a general advisory, kind of come in and say, oh, here are resources in the community that might be helpful to you as well?
Yeah, so most of our patients who come in do meet with our social worker and can go over some of those resources. Everybody who applies to for our services goes through our eligibility screening. Our eligibility team is really great about walking folks through that, connecting them with other resources as well. So really it is about, that comprehensive, that whole care. It's not just about, oh, you have a sore throat today.
Right. So whole life care.
Whole life care.
Yeah. So as we begin to wrap up, I want to be mindful of your time. Is this your first competition back?
Well, yeah. So my first run, so my last horse show too which was many, many years ago. I left in an ambulance. So
What's that?
When you come off sometimes and you land on your head. I didn't tell you that story.
Well, I mean, but the crowd doesn't know that story. so
yeah. I started to jump over a fence, and then my horse decided not to, and then she played catch up, and that just did not end well, and I landed on my head and left in an ambulance and spent about 3 weeks home with a really bad concussion. So I have my, just want to enjoy myself next week. I don't want to leave in an ambulance. I feel like I have personally done my due diligence at supporting your medical community by being a patient. I no longer want to be that acute patient. I would rather just be the preventative.
So competing healthfully, is that the goal?
That's the goal, and having a lot of fun.
I get that. No, that makes a lot of sense. There's times where you're like, I really just want to get in. I want to compete in this way. I want to get home, be healthy at the end of it. So that would be. But do you have I know you, that competitive spirit. You're like, but the next one, I'm really ready to start taking home.
Yeah, I really would. I mean, I have some goals that I really want to achieve, and I, recently purchased a new horse that I'm hoping will help me get there. But this first one is really just about enjoying and being thankful that I can actually ride, because for a long time I didn't think I would be actually able to compete.
Right.
On horseback again. So I'm thankful just for this opportunity and for my family who has been so supportive.
Now, I don't want to go on too many trails here before we get ready to get done, but everyone I know who owns horses tells me that there's this special relationship in owning a horse that's really unlike owning any other animal. And so growing up, I had cats and dogs and all that. And we're presently a pet-free household, so I don't have any at the moment. Do you agree with that? Is there just some sort of special relationship that's with horses that's different than any other animal?
Oh, absolutely. So we have a dog and a cat, and definitely the horses. I mean, if you were a horse owner, you are a different, I think you're wired a little differently.
So what is it? Yeah, what is it?
You have that, they become your family, like, your dog and your cat, but there's just a different bond. And maybe it is because, it's a situation where it's really two athletes. The horse is a tremendous athlete, and then the rider is an athlete too, and having that symbiotic relationship and that true appreciation that your horse is willingly doing all of these things for you that they wouldn't naturally do. It's not like they all wake up in the morning and say, I want somebody to get on my back and jump me around a course, or canter up a hill, or
and there's a lot of care as well. I mean,
there is a lot of care. Yes,
so there's a lot of time.
Yeah.
So is your horse your counselor? Do you talk to your?
Yes, that's what I keep telling my husband. I'm saying we're saving all of this money on counseling bills because I can go to the barn,
just walk through,
and I can just unload.
Do you really? Do you really?
Absolutely, yes, absolutely.
It's like, okay, no one in the barn because mom is telling the horse everything you don't really want to know what's going on in my brain right now.
Absolutely, yes. They're great therapists.
Okay.
And they're very, very intuitive. They actually do have an innate ability to kind of give you exactly what it is that you need in return.
Wow. Okay.
So.
Well, it's just everyone I know who's ever had horses just speaks in that same way. Yeah. It's like this glow on their face or something about a horse. So try not to cry. Yeah. So in the final moments, again, I'm going to put it in all the show notes, but where's the best place to find information?
mossfreeclinic.org.
Okay.
Best place. Go to their website. Go there to donate. My information is on the website as well. People can reach out to me. Corie at mossfreeclinic.org is my email. Happy to answer any questions. Would love anybody who is interested in becoming one of our donors. Would love to give you a tour of the clinic to really kind of give you an organic feel of what it is that we do and the need. I mean,
awesome.
It's growing.
Okay. Well, awesome. Well, gang, I hope you've enjoyed it. It's been a blast for me. I'm glad, Corie, thank you for coming in. Again, please pursue Moss Free Clinic. Find out about it. As a corporate donor or an individual or a time donor, there's so much good that can be done there. Or if you feel like you or your family potentially could utilize their services, please, please, please follow up. On a completely side note, if you have ever had a head injury, and we have both had head injuries, please take care of yourself. If it's a day after you've bumped your head and you are still suffering from a headache, please, please, please go see a doctor, because preventive care is going to be the best thing there. Getting on there. We didn't even talk too much about your concussion, but they're a mess. So don't assume you can tough out a really bad headache or anything like that. But please pursue Moss Free Clinic. Corie, thank you again. It's been a blast to have you on here. And guys, I can't wait to see you again next week. Thank you so much. Bye-bye.
How do you shorten the time it takes to buy a car? Car buying just got easier. Pohanka365.com lets you complete as much or as little of the car buying process online. Pohanka365.com. Car buying simplified. Anytime, anywhere.
Small business owners, you should be praised for wanting to grow your business. That's a good thing, and not everybody has the guts to do it. As a business owner myself, I know you've overcome obstacles that people don't even know about. Hi, my name is Gordon Duncan, the owner of Capitalized Marketing and Consulting, and I want you to know that if your business hasn't grown like you want it to, it's not your fault. If it's not COVID getting in the way, it's ridiculous things like changing social media algorithms. You're right in thinking that very few people are doing small businesses any favors right now. But Capitalized Marketing and Consulting is here to help. We've created a 90-day course that is guaranteed to grow the revenue of your business. It will give you the tools that you've been looking for, and as a certified coach, I would be with you along the way. If you would like to learn more about our program, just visit capitalizeyourbest.com and get started enjoying the success you deserve. Again, that's capitalizeyourbest.com, and I can't wait to celebrate all you accomplish.